Chronic pain. If you know somebody that has it, or if you have it yourself, you're not alone. There are millions of people who have it, about 10 to 15% of the population. Now, there are different causes for chronic pain, and one of them is fibromyalgia, which is what we're going to talk about. I'm Dr. Banasali with Plant Forward MD, and today we're taking a deep dive into fibromyalgia, what it is, the foods and supplements that can help it, and the exercises that are backed by research. Plus, we'll uncover the latest study that reveals the top 3 frustrations that people face who have fibromyalgia, including the often invisible nature of the disease. Let's get started. Fibromyalgia is this widespread pain condition where you have widespread pain, but it also can be localized to certain areas, and there may be fatigue associated with it, and sleep can sometimes be difficult. Overall, your pain is being amplified, and that's why you feel so miserable. But fibro pain is real. It hurts, and it's tough to treat sometimes. But it's there, and we need to take care of it. We don't have amazing medications, but we do have some. But today we're going to talk about alternate approaches to pain from fibromyalgia. What are some of the symptoms? So like I said, widespread pain also could be localized, but fatigue tends to come along with it. Sometimes people complain of brain fog, so not being able to really think their thoughts through or even having memory issues. Sleep disturbances are common, and so is something called irritable bowel syndrome. Difficulty with your GI tract, certain foods are causing disturbances or stressful situations cause problems. That all can be associated with fibromyalgia. Headaches, depression, anxiety are also associated. Not everybody has all of these symptoms, but a lot of people do. There is definite overlap. First, let's talk about my favorite subject, which is food. Fibromyalgia and food, or chronic pain and food. There are definitely foods that seem to be more associated with pain from fibromyalgia versus others. So let's talk about what the evidence shows. Oxidative stress, specifically elevated nitrous oxide, has been linked to fibromyalgia as far back as 2005. So antioxidant levels were found to be significantly lower in people who had fibromyalgia, which makes sense when people say to take antioxidants. However, the studies on taking antioxidants as supplements are not great. But having it in your foods might be okay. And there are some studies that are positive for the supplements as well. But in general, the foods we know tend to do fairly well, even for other conditions that somebody may have, because fibromyalgia is not necessarily a loner disease. It can often come along with a lot of other diseases. As a rheumatologist, I see it often with lupus, rheumatoid arthritis, scleroderma, because pain begets more pain. But on the other hand, you could have heart disease, you could have risks for stroke. So overall, having a healthier diet is probably good. Antioxidants though, where do they come in? One of the things that was shown to be positive was the Mediterranean diet, which we know also is shown to have positive benefits if you have cardiovascular disease or heart disease. So the Mediterranean diet has been shown to be beneficial if you have heart disease, but also autoimmune diseases like multiple sclerosis. Coenzyme Q10 has been in the media, in the news, in terms of helping pain. There was a study with CoQ10, which was shown to have reduced levels in people who had fibromyalgia, and they gave these people supplementation with CoQ10, and it had better results in people who had fibromyalgia with reduced pain. So CoQ10 was helpful in a study. There was a double-blind randomized controlled trial in patients who were given CoQ10, and they were also given pregabalin first, which is a medication that's often used for fibromyalgia. And they found in this trial that people who were given the CoQ10 did improve in terms of a reduction in pain. So supplementation was successful in reducing symptoms and increasing antioxidant levels in this group of patients. However, supplements in general, the problem is we don't know what's in a bottle. There's really no regulation, and it may not help everyone, which is why foods could be suggested. However, there has been other supplements that have been identified as potential alleviators of pain from fibromyalgia, such as ginger, turmeric, and even capsaicin. But we don't have many human studies. We have a lot of small trials, but not any big ones. So we're still waiting for those. Studies have shown that changes in our diet, specifically fiber from fruits, whole grains, vegetables, and other plant products, can significantly change the gut microbiome. So some fiber types like inulin or fructans are considered to be prebiotic, which feed the bacteria, and those can also be helpful. Some studies have suggested that polyphenols, which are found in fruits and vegetables and cereals, can also give health benefits and reduce overall the risk of chronic disease. So maybe it'll help your pain syndrome, but also other conditions as well. On the contrary, when you have a low fiber diet, you have limited dietary diversity, and that itself can be an issue. The Westernized diet, which is also called the SAD, the SAD diet, is associated more with obesity and metabolic diseases, likely because of certain bacteria. But the issue is that if you change to a different diet and you're taking more whole grains, fruits, vegetables, more fiber foods, more berries, antioxidants, it may change your gut microbiome. But if you stop these foods, your gut microbiome will likely revert back to what it was before. So you have to continue this process if you're going to do it. What about using probiotics as treatment for fibromyalgia? Actually, that has been studied, but the supplementation when people were given probiotics did not significantly improve the pain. However, they did influence mood. The authors of that study proposed that probiotics, while they didn't help pain directly, may have a role in neuroinflammation. So for those people that complain of brain fog, difficulty with memory, decision making, for those people, it could be something that might be tried. However, the mainstay of treatment remains to have a healthy diet with high fiber, antioxidant-rich foods. Where does vitamin D fit into all of this? Well, hypovitaminosis D, or low vitamin D, is associated with widespread pain. That's very non-specific. So it's kind of this vague pain that you may have all around. And it was noticed that these people tended to have lower vitamin Ds. But it can also, if it's very low, it can lead to muscle weakness, poor balance, even falls. So it would be good to make sure that is in level, and that's pretty easy to do. It's just a blood test. People can check to see what your vitamin D level is and give you appropriate supplementation if it's low. Easy to take care of. If you've had more than 3 months of chronic pain or musculoskeletal pain, this is something easy to check for. What about gluten? Well, almost 13% of the population has something called non-celiac gluten sensitivity. So you may not be allergic to gluten and have this true allergy. However, you may not feel well if you're taking gluten. That's easy enough to check. If you're having gluten in your foods and you don't feel well, easy to remove them, but make sure, because there's a lot of foods that have gluten in them or wheat in them or a wheat byproduct in them that also could be causing these same symptoms. So yes, check for gluten and see if you have a sensitivity to it, because that is something that you can also do easily enough yourself at home. Pay attention, maybe have a journal to see if it changes your symptoms, because if it doesn't, then it's a food that you may not need to cut out. Back in 2014, there was a small trial done with about 20 patients, and they followed them for about 16 months and found that removing the gluten from their diet improved the pain in almost all of them with fibromyalgia. Does this mean that you should stop eating gluten if you have fibromyalgia? No. It does mean, though, that you could consider it as a potential trigger, so just check whether it bothers you or not. What about the role of stress? Stress absolutely can affect fibromyalgia or myofascial pain symptoms. Definitely when people have stressful life events, whether it's divorce, sometimes even marriage, you're getting all the preparation ready, or your children are sick, there are so many reasons why fibro can be triggered, and stress is definitely one of them. So it is important to have stress management techniques, and everybody has different ones. You may be seeing a therapist. You could go for cognitive behavioral therapy, which can be helpful. There are so many different ways that you could approach this. You have to find one that works for you, because stress absolutely can trigger widespread pain, because also you're not going to get enough sleep. You're going to be tired all the time. You're overwhelmed with symptoms. But oftentimes, as I've seen patients over the years, there is something in the background that they may not be telling me, or maybe even telling themselves really, that it matters, but could be eating away at them. So it's important to kind of get this out, see a therapist if needed, get it treated, because all of this can contribute to a pain syndrome. You don't know where it's coming from sometimes. We talk a lot about cognitive behavioral therapy for fibromyalgia related symptoms, but we want to know, how long is this effect going to last? Well, there was a study published in 2023 that showed that after doing those sessions for CBT, or cognitive behavioral therapy, the effects of those lasted about 6 months. So it means probably that you need to continue after that in order to continue getting benefit. Exercise. Move, move, move. This is incredibly important. So what's the evidence for exercise? Back in 2023, a meta-analysis was published, and it showed for fibromyalgia and exercise-based interventions that there was an improvement in pain. There was an improvement in the quality of life measures and anxiety. It reduced pain. It reduced the impact of the condition itself. So what they had suggested in this study, that most of the exercise regimens should be about 3 days a week. They should be about 21 to 40 sessions overall, and about 60 to 90 minutes a session. So 3 days a week, 60 to 90 minutes, and about 20 to 40 sessions to help with pain from fibromyalgia. The effects of this physical exercise-based intervention lasted about 12 weeks after this program ended, which means that you probably need to continue it to continue to see those benefits. Physical exercise-based therapy is therefore including circuit-based exercises or exercise movement techniques is very helpful for fibromyalgia. So there's some evidence out there. You need to find a good way to move and stick with it because not everybody can do the same things that another person can do. If you cannot walk, go in a pool, try doing aqua exercises followed by warm water therapy because that can feel really good. A lot of people have a lot of pain after they do exercise, but if you end it with a warm water pool, oftentimes that could be helpful. Cycling is actually really good, and recent studies have come out for knee osteoarthritis, knee pain, where cycling improved the outcomes and reduced the pain in the knees. So definitely worth doing. You don't have to go crazy and run a marathon. Really, goals are different from person to person. For you, it may be walking a mile. That's your goal, and that's fine because you're getting out there and moving. Consistency is key. So whatever you do, just maintain it. It can take 4 to 6 weeks after you start a new exercise regimen to really see a reduction in the pain because initially you may have more pain. So see what works for your body and go accordingly. Now, what about alternative treatments like acupuncture? Yes, you can try it, and if it helps you, some people do find benefit from even cupping. So acupuncture plus or minus cupping could be something that's helpful for pain, widespread musculoskeletal pain, but also other exercises like yoga. Sometimes people prefer Pilates or Tai Chi. It kind of depends on what your body works with. I won't say there is a superior exercise in there. The one that's superior is the one that works for you. Fibromyalgia can be very frustrating to the people who have it. And this was highlighted in a study that came out actually this year in 2024 that showed that they were very frustrated. There was a study of about 38 women, and they were asked about all the different things they knew about it and the treatments and how they felt about it. And that was one of the main points, was that they were frustrated. They didn't know enough about their disease condition. They were unsure of what actually caused fibromyalgia. They were unsure about the treatments for it. They felt it was invisible, that other people couldn't see it, which probably adds to the frustration. And they were definitely frustrated about the random nature of all the different symptoms you can get with it. It's tough. That's why everyone's fibro flares are different. So managing fibromyalgia or musculoskeletal widespread pain is so different from person to person. It takes multiple different ways to treat it with or without medications because it's tough to treat overall, but it can be improved. So start with that. Consider using lifestyle interventions like the ones we discussed to see if that can help some of the pain. If you've learned something, please share, and I'll see you next time.